The forgotten implant. I've been longer in this business, I think, even than Andrew. And I've seen a total evolution starting from Insol, who started the first knees that we are doing, the IB1 and the IB2 in the 70s and 80s. First of all, a total knee replacement to me is a misnomer. You're not replacing the whole joint, you're just resurfacing it. And there is still a lot of room for improvement as to what will constitute the best resurfacing material. All the evidence that I'm going to talk about has been on standard all poly tibias, not the highly cross-link ones. And I don't know why the companies refrain from making these despite excellent results in the literature. I'll give you one example. I asked one of the companies that all the poly tibias that I have used over the years have been from Johnson & Johnson. Have you started making it? And I was told that yes, we make it. But when I requested that I should also get them in Pakistan, they raised the price above the metal back tibia. So it was a polite way of saying, use the standard metal back and don't even think about the all poly tibias. Just to give you some history, there's nothing new under the sun. And almost 150, 60 years ago, people started changing these things. And this is the man that we credit with the modern semi-constrained knees that we are using. He started off with IB1, which was all poly tibia, then converted it to the metal backed. And then Bob Scott was the main man who was the father of the modern implant. And I asked Bob at a meeting when I could go to the States that I'm from Pakistan. Why should I change? My people are poor. The cost of a metal back tibia and all poly is significantly different. It's 60,000 rupees currently. And he told me, you don't have to change, but we have to keep pace with the market forces. So we need to change the model, like they changed the model of the car, they changed the grille. It does not necessarily mean that that's a better model than this. But it's taken a lot of years, and now there is a lot of follow-up and literature, and I think mainly because of economic constraints that it's come back into fashion. I don't know how many of you in the NHS are doing an all poly tibia. Hardly any, I think. What is the goal of a total knee replacement? Pain relief is number one. Restoration of normal limb alignment and restoration of function. Different generations, you all know, we've been through first, second, third generations. And this is the one that I'm going to share our experience with you over the years, starting from the 1990s to the present day. The knee design is based on the hip, like the concave surface of the tibia is the cup-like thing, and the convex femur is like the femoral implant. And based on the Charnley's initial design, and I still believe that we've not been able to better the results of what Charnley used to achieve in the late 60s, even 70s. Arif told us about all the methods of cementation, but the modern methods have still not been able to beat the 20-year-old results of what Charnley used to achieve. We have now moved on to the cementless hips. I think it's more in fashion than the knee, and I don't know if the long-term results will bear it out or not. The metal back was introduced with the premise that you could change the insert if it wears out. You will not have to change the whole lot. But it's very, very rare to find just the insert which is worn out, at least in our hands in Pakistan. The whole thing loosens and you need to change the lot. But this was the premise. And they said that because of the metal backing, the results, the longevity would improve. But they had a lot of problems later on between the cement and metal interface, and there has been no data to support that a metal back tibia lasts longer than an all poly tibia. Cementless fixation may be associated with some success, but again, the jury is out at the moment. Different papers that I've taken out to suit my premise that there's been no, in these 9 randomized trials that were analyzed, there's been no difference in the survival, the function, and the pain relief in the all poly tibia and a metal back tibia. The advantages, it's quite reliable. You take off less bone. Again, subjective. The implant migration and backside wear between the plastic and the metal does not occur here, and it's extremely cost effective. The disadvantages are all theoretical. The lack of modularity. If you accurately size it, there is usually no problem at the intraoperative stage. There's no option to just change the plastic bit. If you have to do something, you have to change the lot. And there is no significant evidence that it loosens early. There are no peculiar complications to the all poly tibia. Nothing that does not happen to the other joint. Infection, aseptic loosening, malalignment, etc. It's all technique dependent and your patient selection. These are the things when 2 surfaces come into contact with each other. And this was the worry that people thought that the all poly might have some problems when a metal surface rubs against it or moves against it. But there has been no higher incidence in all polytibia. The studies, again, there is no absolutely top evidence study which says that metal back tibia is higher lasting than the all polytibia. Survivorship is the same in both the kinds of knee replacements. The current cost difference, and this is Johnson & Johnson, and the price they give to my charity hospital. The price is different from what they give in the market because we do everything on a non-profit and no surgeon fee basis. The cost is 60,000 rupees for one side. And we usually do not replace the patella. We do a denervation, and that usually serves the purpose unless the patella is very badly damaged. This is the case, the intraoperative pictures and the postoperative picture. I'll give you a little story here. My son, one is an orthopedic surgeon, the other one is a radiologist. And while he was training in a teaching hospital, he called me up and he says that this is a lady here who you did one knee 8 years ago. Now she's come for the other painful knee. We've taken x-rays, we can't see the tibial component. They consulted their orthopedic people who were young people. They also said, this is a strange knee. She has full range of movement, is stable, is happy, so she wants the other one. So that is when we told them that this is an all poly device. Just to show you a few pictures. This is the rough number that we do in our hospital, and all without operating costs, and all the people who can't afford it, we also drum up the money for them purely from donations from the people of Pakistan. We've done about 356 all poly tibias to date. It's because the companies run out of them and we had to convert to the all metal back. All ages were done. If you read the literature, they say you should do it above the age of 70. No, we did it in rheumatoids at the age of 45 and till 75, irrespective of the weight of the patient. One of the contraindications given in the literature is the heavier the patient, the less the indication of all poly. It's not like that in our series. The range of movement is comparable. The biggest problem currently is the availability. IB1, I told you, DePuy currently are marketing it. but again, very limited ones. And the other companies have suddenly raised their prices. So I'll stop here and I'll just tell you that a veteran who's seen all the development is not against development, but I need us to be pragmatic, especially in this part of the world. We need to see the results and the pocket of the patient. Just like yesterday's, at the end of the day, I asked the experts, a lot of them, what about bone patella bone for ACL reconstruction? It was not mentioned at all. And I was told it's still the gold standard, especially in high, powerful, high demand athletes. So please don't forget this, and I hope it'll work well. Thank you.
Thank you very much, sir. Sorry.